on the link, and happy holidays to you and all of your friends. Again, let us be the first to wish you officially Merry Christmas.
Merry Christmas.
It is, and I guess
out there shopping, please, be safe out there.
yes.
Please.
Yeah, please be safe. We're
Wear
gonna
your mask.
We're gonna tell you all that's going on with Black Friday pretty soon. But kind of fittingly with the now Christmas spirit is our good friend Dr. Peter Lombard, who it seems, Pete, you may be growing like a Santa beard. It seems.
Yeah, it's coming in a little fuller than I expected. But I just wish it wasn't so white.
Yeah, well, you maybe got a couple inches to go by the 25th and everything like. But we know you're someone who always gets stuff done, so I believe you can pull it off.
The eyebrows betray the hair color, though.
Well, how have you been, man? It's been a little while since we caught up with you and everything. I would assume that you are, as a physician and someone who has tracked, the COVID data since the very beginning of the pandemic, you're very pleased to see the CAR score going down, the hospitalizations decreasing, the number of cases, being slowly slowly but consistently on a downward trend over the last couple of weeks.
Yeah, I think it's palpable. We all feel a great deal of relief to see the cases, the hospitalizations coming down. We didn't know for sure it was going to do this. I mean, you've seen in the U.S. the cases from Delta were coming down. Now they're slowly coming up, and we're seeing new surges in Europe. So we were sort of on this really slow downward slope. Then all of a sudden, about 2 or 3 weeks ago, it really dropped. The floor dropped out of the cases. So. It's very, very comforting. But it's this still the dread of the unknown with this coronavirus. It's done things that we haven't expected, and I think we'd be foolish to think there are more surprises in store for us. So that's the unfortunate part. But we're certainly in much better shape now than we were, a month or two ago.
Is there historical evidence that kind of like suggests that like when it comes to a community doing what it's supposed to do and getting the vaccine, getting the boosters, doing all the social distancing things, that is kind of like the trend, like you'll have like a little bit of a decline and then you'll have this like massive improvement? Because I mean, the only thing I can really go on is, how the stock market would behave, under certain conditions economically, or, how a baseball pitcher's ERA would perform and everything like that. But when it comes to healthcare crises and everything like that, is this like the normal behavior?
I think you can find examples of everything. I mean, you can see examples where the surge is very short, other examples where it's prolonged or it starts coming down and it shoots back up again. So I don't really think there's rhyme or reason to it. I don't think that what we did in terms of population, either mandates or behavior, changed much throughout the course of the surge. They started the changing the size of the group gatherings, for example, and not doing much else besides that, other than just to continue to reinforce the normal things, social distancing and mask wearing. I just don't think that those things really played a huge role. I think it's vaccination. I mean, that is, it blows the pants off of any other, any mandate, any sort of other community activity that we could do to get us out of an event where there's a lot of community transmission.
Especially now with the vaccine having been authorized for young people, like pretty much across the board. I mean, all the way down to like 5, and as more people adopt, that mentality. I mean, maybe you will see these, these very meteoric, surges or up or down, depending on how you look at it, of the community improving.
Yeah, that's right. And thankfully, at least, we were spared from, even worse carnage if we hadn't had the vaccination levels where they were. Things were very bad. And I just to think it could have been, many magnitudes worse is pretty humbling.
Doc, do you have any numbers for us?
I do. Can I screen share?
Yeah,
sure.
Yeah.
Here we go.
I was just going to say, aside from lowering the age eligibility for the vaccine, I think also what's important is the booster shots.
Can you say that again, Sabrina? I'm sorry.
Also important, aside from lowering the age eligibility to get vaccinated, is the booster shots, going back and getting your third dose.
Yeah, we've got I think of the eligible population that can be vaccinated, I've got a slide on this. I think we've vaccinated, we've given a booster to maybe 30%. So we're not quite there yet, but it's actually not that bad compared to a lot of other places. And here's, I like to just show how Guam compares to the rest of the United States. And for a long time, we were one of the worst in the country and one of the worst in the world with regards to the number of cases per capita that we were seeing. And the same followed for deaths as well. In fact, we looked even worse comparatively. And here's that sort of that slow decline, and then the floor dropped out, and now we're sitting down here at about 10 cases or so per 100,000, which is just great. If you look at what's going on in the rest of the world, so the orange here is the United States, so you can see the Delta wave there. It was coming down nicely. Most of that Delta wave was concentrated in the southeast with Florida and a lot of those states down there with poor vaccination rates. But it's creeping back up. So the same thing didn't happen when you look at the whole, the United States as a whole. Mm-hmm. Guam in green there, you can see how we dropped off. The European Union kind of behind there in a light purple color. That's where most of the trouble we're seeing today is a lot of Eastern European countries with low vaccination rates. And as an example, I highlighted Austria here, which is sort of off the charts here. Worse than Guam was at our worst even. And Austria is a place where I think they've got maybe 65% fully vaccinated. So not terrible, but also guess what? Better than the United States on average. So I think that the United States, there's going to be a lot of locations in the U.S. that sees a pretty significant surge in the winter months. This is a chart of all of the European nations and their vaccination rates and compared to their death rates. So the vaccination rates are on the left and the death rates over the past 2 weeks are on the right side. So most of the deaths that we're seeing in this surge, this early new surge, are happening in countries where the vaccination rate is low. No big surprise there, but just want to hammer this home. We're seeing this any way you look at the data. If you look at the number of deaths recently, most of the recent deaths are coming from places where the vaccination rates aren't very high. So you can talk about population immunity from natural infection. Some of these places may have had previous waves where they had a lot of people that were naturally infected, but it's still not, it's not going to be as protective overall as having more of your population vaccinated. So, for people that are on the fence about it, I mean, you can either be part of the solution or not. And hopefully there's enough safety data that you can feel comfortable with the vaccine at some point. But being part of the solution means getting more of your location better vaccinated.
What was that country in the middle of that last chart, Doc? Was that Latvia?
LV, that's my assumption is Latvia, yeah.
Yeah, and that is kind of weird because, I mean, they've basically got, maybe 2/3 vaccination, and yet they still have like a pretty substantial amount of fatalities.
Yep, that's true. And that's kind of like what we saw in Guam. We had very good vaccination rate, but way more deaths per capita than you would necessarily expect. So this is pretty much kind of the same thing, but looking at U.S. states and just drawing a correlation line between all those. So you can see there's a clear correlation between high vaccination and lower deaths. And this is just the last 6 months. This is from May 1st. These are deaths from May to November. Now, again, you could say, well, if you were hard hit at the very beginning, then you're not going to see as many deaths now. And there's some truth to that, but there's still a very strong correlation, at least in the last 6 months, with deaths to vaccination rates. There's obviously a clear outliner here with Florida. Despite having a reasonable vaccination rate overall, they have way more deaths per capita. And I think you can, when you see an outlier, you try to consider the reasons why it might be an outlier in the way it is. And I think a lot of people know, the governor's attitude towards, NPI, mask wearing, vaccinations, making it illegal to mandate masks or vaccinate in schools, things like that. So, and I think if you talk to people who live there and just the way that people behave and act, I think there's probably reasons why you're seeing that. And I put Guam out here not because it's a side note necessarily, but if you extrapolate 75% to 80%, and then you go up to the number of deaths we've seen, I did the calculation for the last 6 months, so it would be applicable to the chart. We are a huge outlier on this example. Now, the smaller the location, the greater noise you're going to see and the greater variation. But that's part of the reason why they invited the CDC out to try to figure out why did we see so many extra deaths in Guam, particularly the dead on arrivals. But this is how high we would fall out on this chart. And way to the right here, nobody's even close to Guam and the percent vaccination. And as shocking as that is, again, I always bring back to things could have been so much worse if we had not had the level of vaccination that we did.
What are we up to now? Like 90%, I think. Right, Bree?
We're 80. We're actually about 81% if you go by the latest census numbers of a population of 154,000. So 80%. So 70, 75, and 80s would be about here, and then about 730 deaths per million. So this is a CDC data, just tracks the numbers, same way that we do locally too. But I like just to show that this is cumulative deaths, so you can see how in the first wave, or if you want to call that the first two waves, we had a slow, steady increase in deaths. Very few over the course of the summer, and then when the Delta wave hit, you can see it shoot up there. But you can also clearly see that the Delta wave is pretty much over, and the deaths are plateauing. We were seeing 10 deaths a week almost, and now we're sort of slowing down to just a couple. Same plot, but this time in orange here is the vaccination rate, and I wanted to show this because I think it's very nice to see that even in the midst of the Delta wave, our vaccinations continued. And in fact, I calculated about 15% of the population was vaccinated from this point about a week or two into our Delta surge. And again, I think for me, I firmly believe that the vaccination is the number one reason why this surge was able to fall off the way it did. We probably went from in the mid 60s to close to 80% over the course of this Delta wave. And I really don't think that it had much to do with executive orders or mandates or people just doing things better. I think our behavior in the community was probably similar throughout most of the surge. And maybe in a time when the hospital was really full, that people were a little bit more careful. But this is a chart of, so our cases are in the bottom here, but the top plot here looks a little weird. That's a chart of the case fatality rate. So of all 100 people that were diagnosed with COVID by a positive test, how many of them died? Okay, so you can see early on in the pandemic, we were at a case fatality rate of about 2%, and it dropped down to didn't get any lower than maybe 1.5%. So that means 1.5 to 2 out of every 100 people that were diagnosed died. That's not infection fatality because there's a lot more infections than we actually diagnosed. But what you can see is that even though we had a Delta surge with a lot more cases than we had before, the case fatality rate continued to fall. And that's because of vaccination. Okay. And that's because we have better treatment. So and that's in the setting of a Delta curve, which had obviously we've talked about how much more virulent and transmissible Delta is as well. And if you actually factor in, and we actually know this because they've shown us what we know of the people that have died, how many of them have been vaccinated, how many haven't. So you can use those numbers to calculate a crude case fatality rate for just the vaccinated or just the unvaccinated. And if you look at it, the vaccinated, the case fatality rate, it drops to about 0.015%. So it really falls off. And the unvaccinated is still stays at that high level of 1.5 to 2%. And the two together is how we drop down overall to a lower case fatality rate. So maybe it gets into the weeds a little bit, but I think what gets lost in this, and even in the case fatality rate picture, is that the reason why case fatality rates dropped is because of the population being vaccinated. And it's not just because the vaccine protects us against severe disease and death, which it absolutely does, even over 6 months. But the more people are vaccinated, the easier it is to control the community transmission. And there's, I think, an argument out there that it's the same between vaccinated and unvaccinated. And I'd like to, try to dispel that myth, because it's not true. There are some aspects that are true to that statement, but I want to be very specific about what people mean when they say that. And I'll talk about that in a few slides here. But I wanted to show, this is from the New York Times, the U.S. vaccination rates in Guam here. If we take 125,000 people vaccinated over our new population, that puts us about 80%. So their numbers obviously are not incorporating the new census data that we have. The new census data, by the way, is I think they've only released a little bit of it. They haven't shown, for example, how many people are in each age bracket. I think they've shown the number of people per village, but and it's a little messy. I mean, you can see how just a fairly small change in census data can really change what your percentages look like. I mean, again, it's all about the denominator. How many are you dividing by? Because 73% to 80%, I think, is a pretty big deal, and that's with the census change. So we would have no idea unless those numbers came out. But nobody's even close, except Palau's doing a fantastic job. But we're certainly beating the socks off of any other state, and even Hawaii's down in maybe 61, 62%, which was one of the earlier states to do well, and now not even showing up here on the top 15 or so. Puerto Rico's there. A lot of North New England countries are up there as well. How do we compare if you were to put us on the world stage? Well, these are the top 5 in the world here, and dark green here being the percent fully vaccinated. So we would slip in here, maybe the top 5, certainly top 10 in the world for countries in terms of total vaccination, which is just fantastic. I mean, there's no other way to say it. We're doing a wonderful job of vaccinating. And this inset here on the right shows the percentage that have been given an additional dose or boosted. So I calculate we've boosted about 30% of the people eligible. So that would put us here. But I think this chart might actually be of the population, in which case we might fall down about 20%, 15 to 20% of the population. But still, not too bad. We're in the top 10 there as well. So just nice to see more evidence that we're doing a great job of vaccinating. This shows the deaths on a sort of a different way to look at it. This is the cumulative deaths again. So here's our Delta wave. You can see how our slope just rapidly increased during the Delta wave. But overall, despite shooting up that high, we're still sort of in the bottom 10 in terms of total deaths per capita. So, we were tracking along down here with the very best in top 5, but with the Delta surge, we certainly spiked. And although we didn't do very well at all in the Delta surge, we're still doing fairly well overall when it comes to the total number of deaths we've seen from COVID in Guam per capita. So just some quick number crunching here. There have been about 120 deaths in the past 3 months with the Delta surge. And unfortunately, those 120 deaths came when there's been a free and effective and safe vaccine that's been readily available to everybody. Approximately 15%. I'm using the numbers that I saw from Dr. Pobutsky's slides when she talks about the number of deaths that in vaccinated versus unvaccinated. I think it settled out about 15% on average were vaccinated. So again, you can take those numbers to look at the case fatality rates, and you get about 2% for the unvaccinated and 0.3% for vaccinated. So it's absolutely not a stretch at all that if all of those people that had died were vaccinated, that about 100 of them could have been saved. I mean, I don't think it's a stretch to say that at all. And even if you want to hedge that a little bit less, I mean, even if it's half that, even if 50 lives could have been saved, I mean, that's huge. I mean, we've become so numb to people dying of COVID that the numbers are almost meaningless to us. But if you said there was a massive car accident and 50 people died, you'd be like, holy cow, 50 people died. I mean, but that's, these are the numbers that we were saying. 120 people died in the last 3 months from COVID. And you can talk about comorbidities, and I think there's a tendency to just excuse the deaths because of comorbidities, but these are people that would not, many of them would not have died had COVID not been around or if they had been vaccinated.
Right, but
And
how many, does the numbers say though, how many of those individuals that that did pass away, that did have comorbidities, that couldn't get the vaccine because of their comorbidities?
That's absolutely a possibility, and unfortunately, I don't know that. It'd be a good question for Dr. Pobutsky if she knows that answer, which may not be known. But you know what? There are not very many things that would preclude you to make it an absolute contraindication. You cannot get the vaccine because it's too dangerous for you. In fact, I really don't know of many conditions at all. I mean, unless you're just severely immunocompromised. But even then, those patients are the ones that you do want to give the vaccine to, people that are immunocompromised, because if they get infected by COVID, they're going to fare much worse. So I don't think that very many of those unvaccinated deaths in the past 3 months have been because they can't get the vaccine. Now, there are people that have comorbidities that can't control their comorbidities, and I think that's a much more a relevant question here, because you can't just blame people with comorbidities and say it's all their fault. Obesity, diabetes has been one of the greatest public health challenges, for the past decades, and you're not just going to solve that overnight. You're not going to solve it in a few months, and to think that we can put some PSAs out there about changing your diet, and we just had Thanksgiving yesterday. How many people were watching what they were eating yesterday? But I think that's barking down the wrong tree when it's clear that another safe intervention like vaccination can have much more of an effect. And it's really hard to see people say, well, just they want to throw away the vaccine because it's not perfect. It's not sterilizing. It doesn't completely protect you from getting COVID or even dying from COVID, but it doesn't mean that it's not useful. And I really think when it comes down to the number of people that have died, it could have made a big difference. And the other way to look at it is too, if none of the population was vaccinated, we'd be looking at a case fatality rate of 1.5 to 2%, and the number of deaths that we would have seen, it could have easily been close to 1,000. I mean, if we didn't have an effective vaccine, and that's even with some of the newer treatments that we have. So I found this on one of the Twitter followers that I have, or one of the people I follow on Twitter. But we get a little snapshot of the hospitalized and vaccinated, unvaccinated. And again, you might see, hey, there's 50 people vaccinated and 70 people unvaccinated in the hospital, and then people throw up their arms and say, what good is the vaccine then? Well, if you zoom out and you see how many people are left that are unvaccinated and how many people are out there that are vaccinated, you can see a little bit better, instead of trying to just do the number crunching, which is, understandably hard for some people. Understanding rates and percentages is very difficult for some people. But when you see it visually like this, of everybody vaccinated, the numbers of those in the hospital is just much smaller percentage. So if you're vaccinated, the chances of you being hospitalized with COVID are much less than if you're unvaccinated, where at least in this approximation, you're seeing half of the people unvaccinated are getting hospitalized. And you could even take that even further and draw a smaller circle in here for people that are in the ICU, or a smaller circle in there for people that have died. You might see, just as many people have died that are vaccinated, unvaccinated. But again, the relative proportion compared to the total people out there that are vaccinated, unvaccinated, then it's a little bit more maybe impactful or easier for people to realize that there is substantial protection with vaccination, even if it's not perfect. We're just lucky to have vaccine at all, let alone one that's as effective as it is. This was an interesting chart that shows the remaining states with mandates of any kind, and it's hard to see. So basically, this little grouping of shaded boxes here are any states that have any sort of gathering restrictions on sizes, and there's hardly any. I mean, there's hardly any states that have any restrictions on sizes, whether it's 10, 25, 50, 100. And overall on the right here are states that have mask mandates of any type. And so 1, 2, 3, 4, 5, 6, maybe 6 or 7 out of 50 states have any sort of mask mandate, or on the most far right column there are fines. So I think the point of this is just to show, like, there's not much at all going on in the U.S. for any sort of mandate that would attempt to modify people's behavior. So I think most of it is just what people are doing on their own of their own volition to try to make themselves safer. And Guam wasn't on this chart, by the way, that I pulled up, unsurprisingly. We've given over 3 million pediatric doses in the United States so far. I think that's important for people to understand in the last, 2 to 3 weeks. And so far, no cases of myocarditis. So it's with the decreased dose, it's proving to be a very safe vaccine for the kids 5 to 11. In Guam, we've given about 2,200 doses as of the JIC report from yesterday. And that represents about 15% of the eligible 5 to 11-year-olds. And that's just a guess because I don't really know exactly how many people are in that age group, but I'm guessing it's about 15,000. At the current rate, if we keep vaccinating at this rate, we might have 50% of all the kids in this group vaccinated by the end of January. But I don't know how that's going to go. I'd like to think a lot of parents want to get their kids vaccinated, but I can understand some fear. But hopefully the fact that we've given 3 million doses and we're still not seeing any significant problems, they'd be more willing to do that. And it's not just to protect them. There are a lot of other reasons as well, too, that it makes sense to vaccinate our kids. And the booster shots, we have about 80,000 eligible. That means 80,000 people that are fully vaccinated. It's already been 6 months. Already been 6 months since their second dose. So, and now that the CDC has authorized it for any adult that wants it, that shows that we've only given it about 25,000 boosters. So that's 30% of the eligible, 20% of all the fully vaccinated, and 60% of the population. So again, not bad compared to the world stage. Big question I have, which isn't really clear to me, is how many unvaccinated are remaining in Guam. So if you look at the last JIC report, they're showing there was a big change when they tried to incorporate the new census numbers, but it's a little weird. I mean, if you look at the number of ineligible 0 to 4, they're showing about 12,000 or so, right? Now, if in the 5 to 11 age group, there's got to be at least 12,000, right? I mean, now that's 7 years of kids versus 5 years of kids in the 0 to 4. So it's at least 12,000. If you had to just put a number to it, I'd say guess 15,000. It's probably more than that. But if you say it's 15,000, and then you come over and look at the number of kids that we've given vaccines to, only about 2,200 in that same age group, then you're still looking at about 12,000 kids at least who are unvaccinated that are eligible. Okay, so that they would have to fall into this category here, in the unvaccinated and eligible, right? But if 12,000 are 5 to 11, that only leaves 3,000 to 4,000 unvaccinated adults in Guam. I mean, I just find that really hard to believe that there's only 3,000 to 4,000 unvaccinated in Guam. Now, maybe it's true, and that would be fantastic, because I don't know how else the numbers would work out here unless we're really overestimating the number of kids that we have out there. But that's really not bad. And I think even if all 4,000 or 5,000 unvaccinated were infected, I think there's a certain proportion of them have already probably been exposed to it, and it still could cause a lot of morbidity here. But I don't know. I'm not sure what to make of that. I think it's hard for me to reconcile that. Maybe there'll be some more clarity on that. But I just don't know if that's even plausible to say there's only 4,000 to 5,000 people that are unvaccinated in Guam, because that's a very small percentage of the population. But maybe we're there, and it bodes well for Guam.
That's like one of the smaller villages, 4,000 to 5,000 people.
Yeah, right. Yeah. So I don't know what to make of that. But so even the CDC, I think they're having trouble with their denominators too. You just go to the website, and they're showing 99.9% of the population over 65 is fully vaccinated. I don't think so. So there's some other more global problems here, and I think we just have to realize and understand and accept and be understanding about the fact that these calculations are difficult. They're depending on data that sometimes is not perfect, and they're just doing the best they can. Hopefully that the data gets better as time goes on.
But data inaccuracy aside, Doc, that's interesting. The 99.9. Statistic, because that is specifically what Dr. Pobutsky has said that we need to get to, and she goes, we really basically have to be almost like complete immersion to really beat this thing away. She said that. Yeah, she said that multiple times, and she always really tries to emphasize that point.
Yeah, that's good. I mean, the higher we get it, the better. I think again, if you look at those top 10 countries in the world that have the high vaccination rates, they're doing the best. There's some of them are still having case outbreaks, but their deaths aren't following. There's been this decoupling of deaths from the cases. Just a reminder, when it comes to kids, there are kids dying. 700 or 800 or so have died of COVID in the United States. Of course, they're a lot more protected. We showed this last time, and unfortunately, the infants are dying at a much higher proportion as well. And they're, of course, not cannot get the vaccine. But there's also a lot of other reasons. Yes, we know they're much less likely to have a bad outcome from a COVID infection. But we're also protecting the network that surrounds the child, whether it's other kids, the adults around them. We're helping them break this chain of transmission in the community. And I think a big one for me, if my kids were in school, would be that it will help to prevent, them having to close classrooms or close schools, sending them home again from face-to-face learning. These types of issues are going to keep coming up over and over again. And there's thankfully been a lot more, I think, publicity about the harms of keeping kids out of school. Being able to relax some of the measures in school to make the learning more effective, long COVID in kids. So there's a lot of reasons why I think vaccinating the kids in that 5 to 11 range are still important for the parents on the fence about it. And when you look at the number of deaths, I don't know if I showed this before. These are the number of kids that used to die before vaccinations for each one of these diseases. So even for vaccines that we've had for a while now, fewer kids were dying of this than they are of COVID. And so, for people to be sort of really up in arms about a recommendation to get kids vaccinated is to prevent deaths in kids. And it doesn't take many kids' deaths for us to make a recommendation like this because, kids dying is horrible. They have a life in front of them. So I think maybe this helps to put in perspective that what we're doing and recommending for the COVID vaccine in kids is not unusual, and it shouldn't be surprising based on what we're doing. And unfortunately, this anti-vaccine movement may spill over to other vaccines, and they may say, well, you know what, you're right. Why are we even giving these vaccines to kids if there's even a chance that they might be harmed by the vaccines? And that's sort of the risk that we're taking now by pushing maybe too hard. People like Governor DeSantis in Florida are looking at that and saying, hey, yeah, maybe we shouldn't have vaccine mandates at all. And it would be, I think, a travesty for public health if that spilled over and affected other vaccinations as well. So one quick slide on this idea that we're just as likely to transmit if you're vaccinated and unvaccinated. I've heard this countless times by a number of people. Please remember there's two aspects to a successful transmission from one person to another and then to another. Well, first you have to get infected, and that's key. You got to be infected by someone first, and then you have to transmit it to somebody else. Okay, so there is a study out there which people love to point to that say, well, the viral loads in somebody with a breakthrough infection, you measure the amount of virus in their airways, and it's just as much as somebody who's unvaccinated. Well, there's a lot of caveats to that. Okay, well, first of all, they clear the virus a lot faster, and their symptoms decrease. So the amount of time that they're infected to others is less. Their symptoms are less. So they're probably less infective anyways, even if they have the same peak viral load. Okay, so those two factors sort of decrease this number two, the chances that you might infect somebody else. But even if they're exactly the same, which I truly, absolutely don't believe that they are, even if you're just as likely to infect someone else if you're vaccinated with a breakthrough infection as someone that's unvaccinated, first you have to get infected. And we know that the vaccine protects you from getting infected. So the number one part of this transmission chain of events, it completely invalidates the claim that you're just as likely to transmit to somebody else because you're not going to get it first as easily. And we know from vaccine data that number starts at 90% protection from infection. And that does wane to maybe in the 50% range by 6 months. But even at 50%, you're still 50% less likely to get infected than somebody that's unvaccinated. So I hope this sort of puts that into context for people that are really clinging to this idea that you're just as likely to get infected and transmit if you're vaccinated, because it's absolutely not true. And hopefully there's going to be more data will come out that will make it a little bit easier to for people to see and understand. Latest COVID news, of course, we on the 19th, we had the booster eligible for all adults. I don't know if you guys saw, but we've got 2 oral antivirals now. Merck's made one and Pfizer has made one. And wonderful results. And this is, once people are infected, you give them this oral medicine. It's not a shot. It's not an IV. It's a lot cheaper than the monoclonals. And wonderful results. I mean, really fantastic. So this is great stuff coming down. And maybe if you combine them together, the mechanism of action is very similar to actually HIV drugs, which we use together in cocktails. So if you combine these two, maybe they're going to be even better. Unfortunately, I don't think we're going to be able to use these in vaccinated people. They only tested this in unvaccinated people. So I think that the EUA and whenever these are finally approved will only be for unvaccinated. Costs for treatment. I wanted to add. I added the costs for hospitalizations here. So if you look at states, it varies, but anywhere for a non-complex hospitalization, you're going to spend at least $30,000 on their health care, and up to $100,000 in some states. And for a complex hospitalization or stay, $300,000 to $400,000. So again, the cost to treat somebody, and then most of them, again, your higher chance of hospitalization if you're unvaccinated, of course, but versus the cost of vaccines, versus the cost of the monoclonal antibodies, getting to thousands here. And hopefully, this, I don't know if, I think we mentioned this last time, this is another repurposed SSRI antidepressant drug, which is found to be pretty darn effective to prevent hospitalization as well, and much, much cheaper. So it's not that people aren't looking at cheaper ways to do this. And we looked at steroids, we know they help, and we know this is another potential option for us here too. But we want to find cheap and easy ways that if people are just totally dead set against vaccinated, at least we have a way to try to treat them. The booster data is showing us just a tremendous increase in efficacy when you're boosted. I mean, you get to higher levels than you had at the beginning of your second vaccination. So we're hoping this means, and which we don't know for sure yet, we're all admitting we don't know for sure yet how long this booster is going to last us and how high the efficacy is going to be and for how long. But there is good reason to believe it's going to be at least 6 months, hopefully a year. And some of the folks I trust and follow say maybe it means 2 years, and that would be wonderful. I think I hope people are prepared for that and can come to terms with that this is going to be something that we're probably going to have to get boosters for the rest of our lives, like we do for the flu, and it will be just commonplace at some point. But thankfully, so far, the data in Israel, which I think they've got people 3 to 4 months out from their booster now, so it is still reassuring that things are not waning that much. So the good news in Guam, we're no longer at this high Delta plateau. Our hospitalizations now per day, we're getting close to the number 10, which is just fantastic. Only 1 person in the ICU. That's just wonderful news for Guam. Unfortunately, it did come at a pretty high cost with the number of deaths we had, and we've got just extremely high vaccination rates. So giving Guam a report card here at the end of the Delta surge. Vaccinations, we have an A. We did a really poor job of testing, tracing, isolating, and especially contact tracing. But I don't know how much of that is something that would have made a big impact in the long run. But now that our numbers are low, I think that any future cases that we have, if we really put a lot more effort into contact tracing, I think potentially we could prevent another surge by being a lot more aggressive in that arena. For NPIs, I think if you talk to anybody who's come to Guam from the States, and they're just it's amazing how well we mask here in public, and again compared to vaccinations, I think it's a drop in the bucket compared to getting more people vaccinated. The amount of infections that we prevent with masking and some of these other NPIs are pretty small, but it's still nice to see, and I do think that it has made a difference. I think things would have been worse if we didn't have as many people masking outside. But and people take their masks off when they go to bars and stuff. Maybe that makes it irrelevant. But the deaths during the Delta wave, that we didn't do too well there compared to the rest of the states. But again, it could have been worse. So we don't have a failing grade there. But and overall total deaths, as I showed, we're still in the bottom 10 of states, which isn't that bad. Take home points for today is the last slide. Sorry for boring you guys here, but. I want to just hammer home, same as Dr. Kovetsky, the higher percent of our population vaccinated, we'll have less transmission and less deaths, not just less deaths, less transmission. So again, encourage everybody to be part of the solution. And we know that 80,000 who have fully vaxxed are already ready and eligible for their second dose. Please, if you're over 6 months from your last dose, please get a booster as soon as possible. We don't know how fast it will wane, but we're hoping it'll be 1 or 2 years. There's still no significant concerns for safety issues after billions of doses have been given in adults in the world, and millions now in children. So I hope that gives some people confidence. This is so many anti-vax sentiments talk about it being experimental, and I think I don't know how long it's going to be long enough before people feel a little bit more comfortable with that. You're not just as likely to contract and transmit COVID if you're vaccinated, and I think it's safe to say the Delta wave is essentially over here. I think it is. I think it's very reasonable to relax some restrictions and mandates that probably didn't have much to do with us getting out of this Delta wave anyways.
And you're not the first person to say that, like in your line of work too. Right.
And, there will be another wave, another start of a surge. We don't know when that's going to happen. I think I just reading this morning, there's a new variant of concern called NU. It's a little early to say how dangerous this might be, but it's been found in South Africa and I think Hong Kong. So it's something to keep your ear to the ground on, but I don't think it's reason to panic right now. But the virus is going to continue to change, and we have to hope that it doesn't change in a way that is significantly makes things harder for us in the future. But it could. Again, I think to help prepare for the next wave, just to maybe bolster our contact tracing efforts, and also I really think a cheap home testing is important to identify people that are symptomatic. To be able to do that at $1 a pop, I think is going to be pretty valuable for a lot of people. So that's it. Sorry to throw 20 or so slides at you, but that's pretty much a wrap for the Delta and Guam, I think.
No, very, very, very comprehensive stuff, Doc. We appreciate you breaking it down, and I know a lot of people are going to go through the major takeaways, and they're going to say, okay, I know we're doing all right, but like you said, and right off the top, you said by no means should we let our guard down, completely. There are going to be more surges to come in the future and everything, but as for this current one and everything like that, we're doing all right.
Yep.
Yeah, and relative to the rest of the world, we're actually doing quite good.
We are, especially with regards to vaccinations. You want to be above 80% right now if you can, and we're already there. And we're going to be vaccinating more of our kids. We're going to be boosting more people, and I think it is a stretch to say we're going to reach a whole lot more of the unvaccinated at this point. If they don't want to, they're just not going to do it. I wish there was a way to reach them and help them understand, but I don't know. They believe that the way that they're interpreting the data is the correct way, and it's hard for me to understand. But I can get why they're looking at it that way. But I think a lot of it just stems from fear of the unknown, and the unknown is what if this vaccine causes some other problems that we just don't know about, and that it's just taking what we do know and making a risk assessment and say, do the benefits outweigh the risks at this time? And we believe that was the case, when the vaccines first came out, that the risks were sufficiently low enough that the benefits of saving lives. I don't know how many lives saved would make it reasonable to people that are still unvaccinated to say, okay, it was worth it. If we could have saved, hypothetical, if we could have saved 80 to 100 lives, if everybody was vaccinated, would that be worth it to you to get vaccinated? We wouldn't. There still would have been people that died that were vaccinated, but we still potentially could have saved that many lives in the last 3 months.
And that truly would have been the major breakthrough. People talk about breakthrough cases. That would have been the overall breakthrough. But
yeah.
So we appreciate your insight and your expertise, Doc, as always. And we want to extend our heartfelt thanks to you, and as well our happy holidays to you and your family and your staff. We'd love to have you back, and let's catch up again before December 12th, because as I understand it, on that particular day, there's a certain football game between two of the U.S. military academies that you're probably going to be watching with great affection.
That's right. I'll have my blue and gold shirt on.
Well, Navy is the home team this year.
Yeah. Thanks, guys. I appreciate
Doc.
you giving me some time this morning.
Absolutely.
Happy Thanksgiving.
Anytime, man. Happy holidays.
Same to you. Bye-bye.
And just a reminder that the Guam Emergency Rental Assistance Program, they are currently accepting tenant applications. You can go to www.doa.guam.gov to complete the online tenant pre-qualification application web form or download a PDF form. Applications are also available at the ERA office. For more information about the ERA program, which is being administered